It's Wendy Bowen, physiotherapist with Know Your Body Better. So I was contacted by one of my clients wanting me to see her son who developed an acute onset of lower back pain with some referral apparently into the buttock, not going all the way down the leg, not full sciatica. Very acute though, you really can't function, couldn't tolerate the pain. The pain was quite intense and constant. The hospital was diagnosed with a herniated disc. Now this is without any confirmation of MRI or CT scan, but certainly when you have that intense pain, the likelihood of it being a herniated disc with a lot of inflammation in the lower back is quite likely. Without doing an assessment, I can't really do much for them. But what you're looking at here, if we look at the spine, remember these are the vertebrae in here. The discs are what are between the vertebrae, and a lot of the discs in the lower back are weaker at the back of the spinal column, and that's where the nerves come out. The nerves come out between these holes here. So if you have any degeneration in the lower back and then you get a disc herniation that puts pressure on that nerve, the nerves do not like to be touched, so you're going to get pain from the inflammation, and inflammation pain is constant, unrelenting pain. And the idea, what we want to do with management of these acute is, one, to get the inflammation down, the pressure off the nerve. And a lot of times what we're looking at is opening the hole where the nerve comes out. So sometimes that involves the traction, and I have done another segment on traction. We want to get the traction. We want to release any muscles that have tightened up to guard that. And sometimes heat will help that, sometimes ice. You have to listen to your body. But how are we going to open up these holes ourselves? And what do you do when you have that acute, unrelenting back pain? Well, one is you get into a position of comfort. It's quite often lying down on your back with your knees up. You can just do it this way. Or if you have a ball or something, you take your ball or your feet and just lie in this position, and it should ease your back pain. Sometimes you might find one side or the other more comfortable. That will also help sometimes open up the space between the holes. Now, another thing, if it's going down your leg, one of the things you can try are what they call the sloppy push-up position. So that's where you're just gonna lie in your stomach like this, or up on your elbow. Sometimes in the acute phase, you're just flat, or you might have to take your pillow, or one or two pillows, and lie over that pillow. It should be a position that eases the pain. So you just lie in that position, let the pain settle down using your heat or ice, as instructed by your healthcare professional. And as you get better and better, then quite honestly, sometimes you can do the other movements. So these are the sloppy push-ups. And the idea behind this, as long as it's not too inflamed and pressing more on it, this will actually feel good. The idea behind that is when you actually herniate a disc, it's usually the sitting positions, bending forward like this, or doing heavy lifting that will aggravate that disc position. So we want to do the opposite of the forward bending. We want to do more of the backwards bending. So that's where the line on your stomach may help. You have to find the position of comfort. Doesn't mean you can do not any activity. Sometimes people with disc herniations actually get a lot of relief when they walk. But you have to listen to your body in those acute stages. So you may need some medical intervention, get in contact with a therapist to have a look at it and see if they can find stuff. But positions of comfort, things that bring the pain out of your leg more into your back will be helpful as well. You're taking the pressure off the disc if it's down the leg. Tingling and numbness means you do have a pinched nerve. So it's Wendy Bowen with Know Your Body Better, giving you some tips you can do for acute low back pain.